Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about hypertension and aging. This talk is based on a recent publication by Sun et al. Hypertension Accelerates Aging, Evidence from NHANES database and Mendelian randomization analyses. Background and rationale. The global burden. Hypertension affects 1.39 billion adults globally and is a major risk factor for cardiovascular disease and all-cause mortality. Age-related prevalence. Its prevalence increases significantly with age, rising from 7.3% in people aged 30 to 34 years to 58.2% in those aged 75 to 79 years. The central question, while hypertension is known to be more common in the elderly, is it just a consequence of aging, or does it accelerate the biological aging process itself? This research aimed to provide evidence of a causal relationship between hypertension and biological aging, using both an observational study and a genetic approach. Defining biological aging. Beyond chronological age, biological age often differs from a person's actual age. Accelerated aging means a person's biological age is older than their chronological age. Epigenetic clocks. This study used modern measures of biological age, including phenoage, a second-generation epigenetic clock that estimates biological age using a combination of 9 clinical biomarkers like creatinine, glucose, and C-reactive protein. Phenoage acceleration, the difference between a person's estimated phenoage and their actual age. A positive value indicates accelerated aging. Other proxies of aging. The study also used other proxies for aging, such as telomere length, the frailty index, and facial aging. Key findings from National Health and Nutrition Examination Survey. Hypertension and phenoage. Hypertension was significantly associated with a higher phenoage. After adjusting for confounders, having hypertension was linked to a 12-year increase in phenoage. Hypertension and phenoage acceleration. Hypertension was positively associated with phenoage acceleration, suggesting that it speeds up the aging process. Blood pressure levels matter. The study found that as blood pressure severity increased from grade 1 to grade 3, so did the increase in phenoage. Each 10 millimeter of mercury increment in systolic blood pressure was associated with a 3.3-year increase in phenoage. Causal evidence from Mendelian randomization. Potential causal link between hypertension and several indicators of accelerated biological aging. Key results: DNAM phenoage acceleration, DNAM grim age acceleration, and frailty index. Analyses found that biological aging markers do not appear to cause hypertension, strengthening the finding that hypertension is the cause and accelerated aging is the effect. Subgroup analysis and interactions. Consistent findings. The association between hypertension and higher phenoage was consistent across all subgroups, including those based on sex, age, and ethnicity. Modulating factors. The studies found that the impact of hypertension on aging was more pronounced in specific subgroups, such as men, current smokers, and those with a history of alcohol use. Sex differences. Only sex showed a significant interaction with hypertension in relation to phenoage acceleration, which suggests different underlying mechanisms of accelerated aging between men and women. Discussion and mechanisms, bridging the gap. This study is one of the first to provide genetic evidence for the causal link between hypertension and biological aging in a general population. Vascular aging. Hypertension accelerates vascular aging through hemodynamic changes, stiffening of blood vessel walls, and endothelial dysfunction. Inflammation. The chronic low-grade inflammatory state associated with hypertension may also contribute to accelerated aging processes. Target organ damage. High blood pressure leads to long-term damage in various organs and systems, which further contributes to a higher biological age. Conclusion. Key takeaway. Hypertension increases pheno-age and is causally linked to accelerated biological aging, with a more pronounced effect as blood pressure severity increases. These findings emphasize the critical importance of early and effective hypertension management to slow down the negative effects of aging. Interventions to control blood pressure may not only prevent cardiovascular events, but also extends a person's health span. Future research, including longitudinal cohort studies and randomized controlled trials, is needed to confirm these causal relationships and explore the precise mechanisms by which hypertension accelerates aging. Thank you for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to this podcast. Thank you.